From his southwest Portland home, Hunter Graham watched the mental health of his son Austin go downhill.
He thought that they were poisoning the air and poisoning the water and were trying to kill him. At one point he thought somebody was hiding in the bushes in front and took a kitchen knife and went out to investigate. And so we were concerned.
Austin's parents first started noticing mental changes when Austin went to college. He couldn't finish his biomedical engineering degree and moved back home. After a bad fall, it got worse.
So it's been really hard to tell whether his struggles were from pre-existing mental illness or as a result of the concussion or a mix of both.
Last year, Austin started secluding himself in his room.
Rotting food and, poor hygiene.
Was he resistant to care?
Yes.
The Grahams needed help.
Immediately we discovered, asking around, what you've discovered in your reporting, which is involuntary commitment is almost impossible.
Austin agreed to go to Kaiser's Brookside Center, a mental health hospital, but his stay didn't last long. He grabbed a nurse's badge and ran away from the locked unit, disappearing in the woods for 2 days.
There was going to be no way to break the cycle without medication. But we were told that it was unethical to medicate him in his current state because he wasn't in imminent danger to himself or others.
There was one route left: guardianship. A hard, expensive, and time-consuming process. The Grahams went to court, explaining how Austin was in immediate and serious danger, and his mental health was rapidly getting worse. A judge approved the guardianship in August, giving Austin's mom, Teresa, the power to consent to treatment. But even that is easier said than done.
He's 6'6", like me, and you just, even if you have the right to say you need to go to the hospital, if he refuses, then that's a significant logistic problem.
Even while under guardianship, doctors could observe Austin but couldn't force him to take medication. He didn't reach Oregon's high legal standards for involuntary treatment. Despite his psychosis, doctors said Austin was a low risk of harm to himself and others, and they sent him home with a plan.
My wife, in her wisdom, did not want him released because we knew he was going to fail. The behavioral health plan was set up to fail.
The plan did fail. Last October, while suffering a psychotic episode, Austin strangled his mother to death in their family home. Hunter Graham wasn't home at the time.
Unfortunately, the failure was that he killed her.
Initially, police saw no signs of foul play and didn't suspect Austin. 2 weeks later, Hunter was at the hospital with Austin when his son called 911.
He called police and confessed.
After police arrived, Austin wrote, "I killed my mom and strangled her with my bare hands," on the back of a sheet of paper.
Had you been worried about something like that, seeing your son's mental degradation?
We were concerned, but also relied on what the hospital evaluation was, that he was a low risk.
Teresa and Hunter Graham had been married for 33 years. She was an endocrinologist, a researcher helping people with diabetes and osteoporosis. She's described as having the rare combination of very high intellect with an even bigger heart.
I considered us very fortunate. She is a doctor. I'm a lawyer. We have resources. And even with all that, we failed spectacularly.
Police arrested Austin. He was charged with murder and is now being held and treated at the Oregon State Hospital after a judge found him mentally unfit for trial.
You shouldn't have to commit murder to get mental health care, but that's what our son Austin did to my beautiful wife, Teresa.
Hunter visits his son at the state hospital. Heartbreaking visits for many reasons.
With treatment, he's much better. I saw him yesterday in Salem, and the problem with being much better is he realizes what's happening and what's going on.
It feels to you that Oregon's system is designed to wait for something terrible to happen before getting someone care.
Treatment would have undoubtedly, in my mind, prevented this. She tried to take care of Austin and was still trying up until the end.